Leading requires emotional intelligence. If you're going to be good at leading, you have to be emotionally intelligent. And there are four major areas or domains that go along with emotional intelligence. And the first is self-awareness. So you have to be aware of yourself, aware of your positives and negatives, and keep a check on yourself at all times. Self-management. You've got to be a self-motivated person. You can't be somebody that, if left in your office, just going to sit around and play on your phone. You have to be self-motivated. You have to be socially aware. So you have to kind of watch and make sure that you understand the dynamics within the group that you're leading. You need to know your people well enough that when you come in one day and you see two of your employees sold up, you have to be aware of what's going on socially and find out what's going on and try to help them work it out. And that's relationship management. You have to be the positive light shining on your employees to help them try to get along and do what's best for the team so that you can all meet your goals. So basically, we have to recognize emotions within ourselves and with others. A good leader is somebody that's good at dealing with people, motivating people, giving feedback that's not horribly offensive, and developing trust. Those are really the things that you'll need to be a good leader. There is an ethical and moral component to leadership. Anytime you're in charge of leading someone else, ethics come into play, as does morality. The 5 principles of an ethical leader are serving others, showing justice, respecting others, being honest, and building community. Leaders' ethical responsibilities are to treat followers with dignity and respect and be sensitive to their interests, their needs, and their concerns. In a nutshell, being a leader is treating others as you would want them to treat you in the same situation. Cultural competence is necessary in the workplace as well, and we have different things that we have to think about when we think about being culturally competent. There are a few groups that I've listed here that have some examples of some things that go along with a lot of, let's say, veterans. They value loyalty, they respect authority, and they want reward for their hard work. So those are all good traits to have, and they are good to know when you have someone that's working under you that is a veteran. Baby boomers, they view the future with optimism and promise and desire to prosper financially and contribute meaningfully. Okay? Generation Xers, they're loyal to their profession, but they're unwilling to sacrifice for the employer. In other words, their home and personal life is very important to them. Millennials tend to be open-minded, they like to collaborate, and they're also civic-minded. So these are just some generalities that don't fit everybody in these groups, but that are good to know and examples of being culturally competent. So when you understand your employees better, it's easier to be a good leader. What is delegation? Let's talk about delegation. That's assigning tasks or duties to an entrusted individual. It's getting work done through others and directing the performance of one or more people to accomplish organizational goals. And it can be a little tricky when you talk about delegation questions on the NCLEX. And we're going to practice this a lot because you're going to see a lot of this in your nursing practice as well as on your test. You need to be able to know when to delegate and when not to delegate. Okay. NCSBN Delegation Guidelines 2016 lists the responsibilities of a licensed nurse, the responsibilities of a nurse leader employer, and the responsibilities of a delegatee. And here is the NCSBN delegation model. Okay? And you see in the middle there, public protection and two-way communication is a part of everything, but in the very center there, public protection is our goal. Okay? I'll leave this up for a second and let you look over these. If you need to look over them a little further, just pause your video for a minute. Alright, so responsibilities of the nurse leader or employer. The employer has to identify a top dog or the top nurse leader within their facility. Usually you're going to have a chief nursing officer, a CNO. Okay? And the designated nurse leader is responsible for delegation, ideally with a committee, so that the committee can kind of come up with rules and regulations on how they want to delegate, so that there will be other nurse leaders, and the whole purpose is to address delegation. And that's basically saying RNs will do this, LPNs will do this, UAPs will do this. And in most facilities that I've seen, you have the chief nursing officer and then you'll have individual leaders of each department, like an ICU leader or manager, nursery manager, L&D manager, that kind of thing. And they all get together and talk about how things will be delegated. So there should be policy and procedures in place for delegation in each facility. And all of this information should be communicated with the LPN, the RN, and the UAP. But when the nurse leader, let's say that you're maybe the charge nurse for the day, it's your responsibility to make sure that the LPN and the UAP know what their responsibilities are for the day. And all of the people that you're delegating to have to demonstrate knowledge and competency on how to perform that task. All right? That can get a little tricky sometimes in you knowing whether or not somebody is competent to do their job. That's why we have standardized checkoffs in every facility that you have to go through before you should be working. The nurse leaders are responsible for delegation, and periodically they have to reevaluate that delegation process. And of course, the employer nurse leader has to promote a positive culture and work environment for delegation. In other words, you're not going to be unfairly delegating. Let's say that you have an LPN friend, you're the RN, and then there's another LPN working with you. You better not give the LPN that's your friend the better assignment. It has to be fair. So some hints, we're going to work on this quite a bit in this unit, but some hints to help the RN know when to delegate. You cannot delegate nursing judgment. So if there's a judgment call to be made, you're the one that has to do the judgment call. You can't delegate that to someone else. You cannot delegate critical decision making either. And of course, we have to be familiar with the LPN, UAP scope of service and make sure that we're delegating within the scope of service for each of those types of people. Education Educating a patient is rarely delegated. However, you can delegate reinforcement of education to the LPN. The LPN is the technical nurse. So routine technical jobs are really good areas to delegate to the LPN. ADLs are things that you would want to delegate to the UAP unless there are some kind of extenuating circumstance. And I'll give you an example. If you have a patient that's having trouble swallowing, you would not delegate feeding that patient to the UAP. Okay, that's just a little example. If the words evaluate or assess are in the question that you're trying to answer, you probably will not delegate. You won't delegate the evaluation or the assessment of the patient. And most of the time, you're going to communicate with the patient over family or friends that are with them. So what are your responsibilities when you're delegating? You're going to have to take into consideration the practice setting. Are we talking about in an emergency room? Are we talking about on a med-surg floor? Are we talking about in an office setting? You will take into consideration the patient's needs and their condition. And of course, the state and jurisdiction's provisions that are set out for delegation, as well as the policy and procedures that are set in place by your employer regarding delegating a specific responsibility. Okay, so the licensed nurse has to communicate with the delegatee who will be assisting in providing patient care. That just means that you have to have an open line of communication with the LPNs or UAPs that will be under you. So you also have to be available for guidance and questions. That means that you don't delegate all of your work and leave the floor. You know, that would be inappropriate. You have to be available. And sometimes you have to not only be available, but assist with what the responsibility that you gave the person. And sometimes if something goes wrong or the conditions are just overwhelming for the LPN or UAP, you may have to do the bath or the whatever, the med pass yourself. It just depends on, you know, the circumstances and what's going on. So don't just assume that you'll be delegating all of your work or all of the care of the patient to someone else, because that is definitely not the case. You also have to follow up with the delegatee and the patient to make sure that what you delegated was done, was completed, and was done well. It's your responsibility to do that. And you have to provide feedback and information to the person that you delegated to regarding, you know, how they did. Make sure you tell your UAPs, man, you did a great job with that. Thank you. And the LPNs, that was awesome. Man, that was great. Or you may have to give a little helping hand. You know, whenever you deal with someone with fragile skin like Miss So-and-so, maybe you could use a lift to lift her instead of pulling on her and tearing her skin, that kind of thing, just little things. And you won't have to do that too terribly often if you have a good crew that you work with, and it won't take you long to figure that out, as you probably know already from being a nurse. So, what is the responsibility of the patient that you're delegating to? They have to accept the delegated responsibility, and they should only do that if they have appropriate training to do that and feel comfortable doing it. Depends on their training and what's wrong with the patient. So you may have a time when somebody you're trying to delegate to says no. So you're going to have to look into that a little bit further, and maybe it will be just a matter of teaching them how to do whatever you're needing them to do. And then the next go around, they'll be able to, you can go watch them do it, and then the next go around, they'll be able to do it on their own. but they have themselves to protect as well. So always remember that, and try not to get into conflict if somebody tells you they can't do something. You need to just dig a little bit farther and see what you can do as the leader to help adjust things around so that they can get their job done. And you have to make sure that they have their competencies maintained. Usually whoever is over education in your facility will keep up with those competencies, so you don't have to ask every single time you go around and work with somebody, are your competencies done? Unless it's your responsibility as the manager of the department or the education manager, then of course you might have to do that. So the person you're delegating to needs to be willing to communicate back with you. So there are so many, just a plethora of things that you can delegate that you're going to have to communicate with the delegatee on, and they're going to have to communicate back with you. So once they verify that they've accepted the responsibility of whatever you're delegating, they're accountable for carrying out the delegated responsibility correctly, completely, and timely, and accurately documenting per the facility's policy and procedures. That does not mean that you are not responsible for making sure that it was done, as we've talked about already. So there can be all kinds of issues when it comes to delegation, but patient safety has to always be maintained. That's the most important thing when you're talking about delegation. Is it safe to delegate this to another team member? And we talked about delegating fairly. Like, don't play favorites with delegation, that's for sure. But delegating fairly does not always mean delegating equally. So maybe you're working with, we'll say 2 LPNs again. One LPN is brand new, and the other one has been an LPN for 20 years. You probably will not delegate equally to those 2 LPNs. The more complex cases you will probably give to the more experienced LPN, and help the other LPN get experience by maybe giving them an occasional complex patient, but you will be working more closely with them with that complex patient, if that makes sense. So your more experienced LPN, you may trust her to work on her own, or him on their own, a little bit more than you would the new LPN. You need to be more available for questions, more available for any problems that they may come up against. So according to the ANA, there are 3 elements that may not be delegated ever. So that's assessments and anything that requires professional judgment. Okay, so making a decision about the care. Coming up with a nursing diagnosis, the goals for the patient, the plans of care, and the progress of the patient are things that cannot be delegated. Any interventions that require the application of professional knowledge and skills, so again, anything that requires that professional judgment cannot be delegated. So if you have problems with people getting their work done or getting the delegated portions of the work done, maybe you should try deadlines. Okay, so if, let's say, your UAP is doing vital signs on your floor at 7 o'clock, but you're not hearing about any out of whack vital signs till 10:30, you can give a deadline. And sometimes it may be patient specific. You may say, Mary, I know you're doing vitals this morning as you normally do, but I want you to take Miss Smith's vitals in 203 first, and then I want you to come let me know what they are, because she is having some, you know, problems with their blood pressure or whatever. So be specific about the deadlines. I want you to come to me immediately, so I will expect that result by 7:30. And just let her go on and do what she's going to do. You need to try to avoid over supervising. So make your deadlines clear. Say what you're going to say. I need you to do this and I need it done by this time. But then step back and let them do their work. If you're getting some resistance or even refusal, like we talked about a few minutes ago, first you need to assess the reason. Why are they resisting? Do they not know how to do the job? Are they just being difficult? Are they, why? What's happening? Do they have maybe know this person and they don't want to go into the room? I mean, you just don't know. So if you come upon resistance or refusal to perform a task, make sure you're digging in a little bit deeper. And then take appropriate action to remedy the situation. Sometimes that means you have to go up the chain of command, but sometimes you can take care of it at your level. And remember, this is very important. If a patient has not been assessed by an RN, delegation should not occur. Okay? So what is collaboration? That's just, in a nutshell, working together. And you kind of have to have a mutual agreement to work together. So to have a successful collaboration, you have to agree on a plan of care and prioritize the components of the plan of care. You have to have a really, really good communication and mutual respect for each other. The RN is responsible to ensure that the plan of care is implemented, evaluated, and modified so that patient outcomes are the best that they can possibly be. No matter how many are collaborating on a particular patient, that is the RN's responsibility. Don't forget that. So, collaborating and advocating through the medical plan of care. Who is the manager of the medical plan of care? That's the physician, right? So as an RN, we have to anticipate the medical direction we're going to go in. We have to understand the orders that are written. Don't guess, but understand. Make sure that you understand. And we have to foresee how they will affect the patient and the patient care. We have to understand the complexities of patient care management in order to best advocate for our patients. As a leader, you're going to have to learn to manage some conflict because you're going to have opposing feelings, beliefs, different desires, different goals. So there are different kinds of conflicts. I mean, you can have intrapersonal conflict. That's conflict within yourself. Interpersonal conflict is conflict between or among two or more individuals. Intragroup conflict is one group against another. That would be like nurses against respiratory therapists. Intergroup would mean between or among two or more groups. Administration against nursing against respiratory therapists. We're all against each other. That's not how we want it. So we need privacy when we have conflict. Some people, I hesitate to say showboat, but they do a little bit. So maybe you're having some conflict and they just like to get loud to draw attention to themselves and what's going on. So make sure you take care of any conflict in private. Make sure that you talk calmly and rationally. And if the person that you're speaking to is unable to do that, you may need to stop this process and discuss it at another time. Or you may need to take it on up the chain of command and discuss this problem or conflict in the manager's office with you and the manager and the person or persons involved. So, sacrifice resolution. This means that someone accommodates the other by sacrificing his or her position. So they give in. They give in and let the other person have their way. Competition resolution is when one or both of the parties work competitively instead of cooperatively toward a resolution. So one side wins and the other side loses. And then you have the win-win resolution, which is always the best. You have a collaborative method, so everybody's involved. Two opposing parties come together to decide on mutual goals, and they design interventions to meet those goals. So it's working together and making up goals and then evaluating the outcomes. So you may not, in a win-win situation, you may not get exactly what you need or want, but some of what you need, the most important things, you won't have to compromise on, and neither will the other person. Somehow you work together to come up with a mutually, good result.